Hey, what's up, everybody? This is Ben Kinney, publisher of Business North Carolina Magazine. And recently we gathered some experts in the field of life sciences, even drilling down more specifically, biotechnology manufacturing, biomanufacturing, and supply chain. It's really an important industry in the state, and we are happy to have these folks together to talk a little bit about its importance, especially in light of the pandemic, vaccine manufacturing that we hear so much about, as well as supply chain issues, which are so very important that all of us know a lot more about now in business and in regular life after the past year. So here is a snippet of that conversation, and you will be able to read more of that in our upcoming May issue of Business North Carolina. Enjoy. And let's start off with some brief introductions. This is Leslie Isenhour. She is director of the BioNetwork Capstone Center, and she's also department head of biotechnology problems at Biotech Community College. Welcome, Leslie.
Thank you. I appreciate it, Ben. It's good to be here.
Good to have you. Good to have you. Hey, so we were just talking a little earlier, and you have just joined Biotech about a month ago. So tell us a little bit about yourself and how you got to be at Capstone, and also tell us a little bit about the BioNetwork Capstone Center as well.
Sure. And as you said before, I'm over the BioNetwork Capstone Center and the Biotech department head at Biotech. And but before that, I worked for 13 years for Johnston Community College and kind of built the program step by step. And the great part about it was such a great partnership with our local industries in the area, Grifols and Novo Nordisk. And I say that I kind of grew up with their grow up, right? They have had a lot of expansion in Johnston County over the past 10 to 15 years. And I was just thankful to be a part of that. In my role there, I was over degree programs, certificate programs, and a lot of the industry training we did. And before that, I was a pharmaceutical engineer at a company, and before that, I was a student. So really, most of my career has been in education, but specifically biotechnology and related. So it's a passion of mine, and I'm just happy to be able to do it for Biotech and the state of North Carolina now. A little bit about Capstone. The Capstone Center, and not a lot of people know just how diverse Capstone really is. It's one piece of a lot of different types of training that you can get in North Carolina as an industry, and it sits on North Carolina State University Centennial Campus, and it's a part of the BTech Center that's there. And as you know, there's a lot of growth going on in terms of building and programs there at NC State now. And it's been a collaborative effort going on around 15 years now to build up that arm of the community college system and be able to do some high-end, high-tech industry training. So a lot of great people that work there. And as far as the Biotech side, the biotechnology programs we offer, when they created the new department, because it was spaced out a little bit, it had different programs all, in different areas, but Dr. Rawls had a vision to kind of put all those programs in one area. So that I think that's going to really help us move forward. But with that, we have an associate's degree in biopharmaceutical technology. Mm-hmm. And also an associate's degree in biotechnology that starts this fall. So we have a lot of new stuff happening.
Absolutely. Okay, Christine.
Hello, everyone. I'm Christine Vannais. I'm the Chief Operating Officer of FUJIFILM Diosynth Biotechnologies, here located at the southern edge of RTP. We've been part of the biomanufacturing network for many years, and part of the founding members, but have changed names over time, but have been FUJIFILM here since 2011. I took over as COO on April 1st of 2020. So quite a challenging year, but happy to be here and share some of our experiences, as well as some of our exciting expansion news and how the state of North Carolina really secures our future and continues to support the growth that we see and the potential that we see in the biotech industry.
Thanks, Christine. John, you're next.
Okay, good morning. I'm John Wagner. I'm the program manager for the Biomanufacturing Forum now. My history is after spending 4 years out of college teaching high school math in Philadelphia. I went to work for Merck in 1981 and had various jobs with Merck, all in manufacturing, a little stint. I call it my purgatory in administration. But then I came down here to start up and build and start up the Durham facility. How I got from math to making vaccines is a long story for another time. But and then I retired at the end of 2012, and in 2014 I went to work for Sam in NC Bio, running the biomanufacturing forum. And so the forum's role has changed a lot in the last year. We focused on helping companies sort out what all the plethora of orders were, and Sam was very good at that. And he and I worked together on and I remember educating him on the fact that, manufacturing sites don't have an army of people to decipher these laws and things like that. So that's a role that he could play as a lawyer. And I think it was very valuable, but so it kind of changed from what we were doing before. Now we're trying to get back into the norm. But I spent 31 years with Merck, a fabulous company, and I love the industry, and so that's why I've stayed involved.
Thanks, John. Gary, you're up.
Okay, thanks, Ben. So yes, hi, I'm Gary Gillespie, and I am the director of the Biomanufacturing Training and Education Center at North Carolina State University. We go by BTech. We, as our name suggests, we do a lot of training and educating of students in the area of biomanufacturing, and in particular in the area of biopharmaceutical manufacturing. Our students actually come from many places. Many of our students are NC State students. We have a variety of programs that we offer them. Many of our students are professionals. We also have a very large professional development program. And we do a number of other things too here at BTech, really to kind of serve industry. And BTech was put in place, the facility actually opened up about 14 years ago, really to kind of spur on economic development in the biopharmaceutical industry. And so we're very proud of our contributions to that, and I'm looking forward to having an opportunity to talk about some of that today. Just very briefly on my personal history, I actually started here at BTech 14 years ago. I came from industry. In fact, I worked for a number of years at what was then Diosynth, is now FUJIFILM Diosynth. It provided an excellent training ground for biopharmaceutical manufacturing. As a contract manufacturer, you get to see a lot. And I and others at BTech, many of my colleagues are also from industry, bring all of that industry experience into BTech, and the training and education that we provide both our NC State students and our professionals is very industry focused as a result. So, and that we're very proud of too. So anyway, I'm looking forward to the conversation today.
Thanks, Gary. Just if I can get an update from you out there on campus at NC State, what's the general feeling right now with today's announcement about Roy Williams retiring from UNC basketball?
Well, if I'm being honest with you, that's news to me. And I will tell you, there are so few students on campus right now. In fact, I teach in about 2 hours that I haven't heard anything yet. So, but I'll find out from my students what they think in about 2 hours.
Sounds good. Sounds good. Matthew, you are up, my friend.
Good morning, everyone. I'm Matthew Robertson. I'm with Nexon Pruitt. I am a healthcare lawyer, and we've been working a lot more in the life science industry over the last several years, partnering with our economic development folks, and this has been across the Carolinas. And we have been representing companies and individuals, particularly during the pandemic, on dealing with regulatory issues, economic development issues, and corporate issues, and some litigation issues dealing with the ever-changing environment. But our firm is very involved in economic development and representing life sciences companies in the biomanufacturing realm in the Carolinas and outside the Carolinas. So look forward to talking to you guys this morning.
Thanks, Matthew. And finally, Doug.
Hi, good morning. I'm Doug Edgeton, President and CEO of the North Carolina Biotechnology Center. And if you don't know about the Biotech Center, it's been around since 1984, and it was formed by bipartisan support from the state legislature to focus exclusively on growing the life sciences in North Carolina. And we have been doing that very successfully. We stand on the shoulders of giants before us who set out a platform that has allowed us as a state to be among the most advanced in biomanufacturing, actually in bio life science in general. We generally rank somewhere between #1 and #4, depending on how you count. The state has continued to see enormous growth, even in COVID, and our team has been as busy as ever. My personal background is I came out of medical school administration. I was a senior associate dean at the University of Alabama for about 15 years, and then came to Wake Forest and was the senior vice president for the medical center for most of my career there. And really, I was in economic development. We started building the research park, and it was my project. And so I ran that project in downtown Winston. And you can see about $1 billion has been spent and really changed the downtown area of Winston-Salem if you go over there. So when this position came open, I moved over and became the president of the Biotech Center in 2014. And have been enjoying working with this team and everybody in the state. It's been a great job, so thanks.
It's a great team for sure. We've been working with it for many years as well, especially from a communication standpoint, and they have done a really good job of getting the word out, from that as well. So I'll just start with you, Doug. Just tell us from your perspective, and that's kind of a more broad group of companies and whatnot that you represent. How did the last year pan out? What were some of the things that stuck out to you in terms of just like looking back after a year of this?
Well, we mentioned Sam Taylor in the beginning. So Sam and I spent a lot of time when this first started coming up about what to do with COVID, and working with the General Assembly and with the local delegations to find out what we were permitted to do. Fortunately, the life science industry, really biotech industry, biomanufacturing, was deemed essential. And so that allowed production to continue and operations to go through the year. We have seen rapid growth in this industry over the last year, and we have had a number of announcements. 2 years ago, we did a study, and we were thinking, based on interviewing 58 companies that are the largest employers, that we would need probably around between 5,000 and 7,000 new workers over the next 5 years. And just last year alone, we announced 2,800 new jobs. So the growth has been phenomenal. The opportunities for North Carolina are still, our reputation as a site is growing. And I think you're going to see a lot of cell and gene therapy activity going on in North Carolina for the foreseeable future.
That's been a big topic, gene therapy, over past couple of years for sure. Matthew, if I may ask, what from your standpoint, you mentioned that you worked with a lot of different clients, especially over the past pandemic, the year of the pandemic and such. From your perspective, what did you hear from your clients about the past year?
I think last year was about resiliency for our clients and taking the threat and the economic and the health threat that the pandemic created for the workforce and their business, and turning it into opportunities. So we have many examples of manufacturing and other life sciences clients pivoting and trying to respond to the need, whether it be converting from manufacturing something else to manufacturing hand sanitizers or creating PPE opportunities. We saw a lot of that. We also saw a lot of questions about, how do I get PPE? Can I sell it? Can I buy it? Can I distribute it? Dealing with the regulatory framework. And then, but what I was most impressed with, now that we're over a year into this, is the resiliency of the industry, and the fact that, as Doug alluded to, there's actually been growth during this time. When I am not surprised, but some people may be surprised to hear that during this tough time for the country, certain subsectors of it did very well, and this is one of them.
Thanks, Matthew. If I may ask Christine, being representing a company and a business, and I know that you all had a lot of things happen over the past year. Can you elaborate on that a little bit for us?
Yeah, absolutely. The pandemic did two things. Really had the focus on continued operations and employee safety. And I would say the information provided by the BioForum and the surveys and the partnership was essential. You kept asking yourself, are we doing everything we can do? Are we doing the right thing? And having that network here locally to just connect into and be supported by, and regular check-ins, because in the first 3 to 6 months, things change so quickly. And to be able to stay on top of that, really with the focus of the employees that are coming on site to continue to manufacture and develop. For us, it's clinical and commercial batches. So they're patients waiting for these therapies that we're making. And at that point, we have 50 different projects here that were underway, all of which have, delivery and deadlines that we needed to continue to meet. It was quite challenging to take the operation, adjust the shifts, adjust to all the social distancing, the mask use, and continue to layer on all the countermeasures to keep operations going. And then to respond, the individuals had, health concerns. They had concerns for their employees, their families, their colleagues. We found that having occupational health nurses here was such a tremendous help, and the support network for the colleagues, having that in place was terrific. But it went well. We feel like we did looking back, a real solid job of preventing transmission on site, dealing with cases as they came up, preventing spread across. But we do work in areas where in manufacturing suites or with maintenance staff working closely together on a skid or piece of equipment, they are closer than 6 feet together. So if you have a case, you're impacting a group or a department, which for us, having the contingency plan is, how do you continue the batch? These are live cells. This is a live downstream process that's got to continue, and making sure we have people trained and backup trained and alternatives in place to finish the batch that's in process. We may have paused. We may have made sure we had everything and everyone back online before we start the next batch. Those are really difficult decisions. And because we're client-based, working with our partners who weren't on site with us through this was, it was challenging, but we also learned so many great lessons. Throughout the pandemic and continuing operations, we actually completed 4 process validations for 4 different programs. That's an amazing year without a pandemic. Imagine when you're splitting shifts and you can't, normally we would have our clients standing by us in the suite and getting data. We had to do all of that remotely and making sure that they had the data they needed to continue. And really it came down for us, the trust that we built throughout the process helped us overcome the challenges that we had, internally and externally as well. So it took the 115% effort to make sure that we were closing those gaps that, transitioning some of the things transitions to Zoom or, these virtual meetings are fine. Other things were much more challenging. You can't get into the suite or into the laboratories easily. Now, we also found some cool technology to help us bring people along with us, but it evolved. It evolved over time throughout the whole year. And I think there's definitely a list of lessons learned. We're going to continue some of those things into the future, But other things were like, no, that we got to do that in person. It's just getting, training new employees throughout this process. Throughout this year, we started COVID-19 vaccine manufacturing, and we onboarded over 100 people. So we were able to recruit and onboard and train, and some of that has to be in person. So it was a tremendous year. We're really proud of the work that we've done, especially on the COVID-19 vaccine. It's one of the programs we can speak about because it's in public domain, that it is with Novavax. We've started manufacturing in July and have never stopped, 24/7. And this is a mission that people volunteered and wanted to be part of and wanted to be part of the solution. But it was also quite different because it was managed also and supported by Operation Warp Speed. And so you had a network of support there that you had to tap into. We had an embedded major on site with us to help us with our supply chain, which is now and have a very, very challenging part. Do you have every component that you need to run every batch? In that program we did, and we continue to do that. But as all the COVID therapies and vaccines are drawing that supply chain, it's continued to be challenging and will be continued to be challenging through this year and the future.
Well, it's interesting that you say that. It's kind of like this past year when I'm hearing from a lot of companies, especially ones that said, we've been busy, we're actually growing and things like that. It wasn't, there's no business. We need to figure out how to drum up new business. It's basically the business is either, staying the same or increasing, and we need to find a new way to keep it going, from that standpoint as well. Hey, Gary, if I can ask, workforce development has always been, that's something that's evergreen, it seems like, in terms of challenges and people, when we have these discussions in every industry. From your standpoint, where did you see some interesting things staying the same or some things changing over the past year in terms of the folks that you work with?
So, this was definitely a year of change for BTech for sure. And, I like the word resiliency because I find most of our folks here at BTech were quite resilient throughout all of this. So when BTech teaches, most of the courses, both for our NC State students and for professionals, are very hands-on. So we're running large labs. We have a built-in manufacturing facility that we're trying to run. And mid to late March, a year ago, basically all of that came to a halt because we were told we had to leave campus and that most courses were going online. And so that obviously had an impact on our academic programs. It had an impact as well on our professional programs. But what it meant was that we had to really quickly create virtual lab experiences for our students. And this was sort of a change in mindset for us because we're so sort of hands-on, is so ingrained in what we do. But we did that. I don't know that I can honestly say that virtual labs are better than hands-on. I look forward to when we can actually go back and be hands-on. And we're doing more hands-on now this semester for our NC State students. But that was certainly a change. But one thing that did come out of that, it really got us thinking about the courses that we offer, both to our NC State students and to professionals. Can we do more online training? Does everything have to be hands-on? And so we've actually found a number of opportunities to create new online courses, especially for our professionals, courses that honestly, a year ago, I don't think we would have ever considered doing online. But now that we know we can do it, our skills in developing online courses is getting better, and there's a demand for it. We've had numerous requests from companies to do online training. I think that's really a shift, at least in BTech's focus. We'll always do hands-on, and that will always be our focus. But more and more, you will see us putting out good online content, and that just allows us to reach many more people, which that's all a positive thing. But a few other positives that came out of the pandemic. Really, we did learn, that hey, Zoom is a great tool for a variety of things. One of those things is seminars. So, for our students, we like to bring in a lot of great speakers, and you can do that fairly easily on Zoom, right? We can bring in speakers from anywhere across the world on Zoom. And so we've actually really had the opportunity to enhance our seminar program now that we're out of the mode of thinking, we've got to get people in here and be physically present. So that's been great. We took the opportunity to get into hand sanitizer production like a number of other organizations did. We were not a hand sanitizer producer previously, but we jumped in there and we have supplied much of the hand sanitizer that NC State is using. And then the last thing I would say, and this is, I think, really a huge positive, is that I think that there is an understanding now of sort of biopharmaceuticals and in particular vaccines that did not exist a year ago. We are constantly having conversations amongst each other with our students about vaccines. And they're, that's one of the types of biopharmaceuticals we train our students on. And that's all been good. I can actually go into class and talk about current events in biopharmaceuticals, right? Which a year ago, I really didn't think in that way. So I think the focus that the pandemic and vaccination against the pandemic has put on vaccines and biopharmaceuticals in general has been a real positive.
That's great. Thank you. John, from your perspective and the folks that you're working with, take a look back at the last year and what were you hearing from those good people?
Well, I want to touch base on a couple of things. First, I want to expand on what Doug said about the economic development and the 2,800 to 5,000 to 7,000 jobs. In this industry, those jobs are relatively permanent as you can get. To hire 1,000 people in a plant, that's probably $1 billion in investment. So you don't pick that up investment and move it very quickly, like some industries that are chasing $1 an hour pay rates and things like that, right? So if we announced 2,800 jobs last year, there's small ebbs and flows, but those are 10-year plus jobs and they're good paying jobs, right? So it's not only the new jobs, but it's the permanency, and nothing's forever, right? But it's the permanency of those jobs and the stability of those jobs. I think that's really, really important. And then something that, Christine touched on, employees coming to work, and I don't mind to over trivialize this, but I had confidence that the companies would figure out internally how to operate. They would figure out the logistics. These are smart people, right? And this is a bump to them, and they've figured it out. But the processes are very complex, and the more that people are distracted by outside influences, the more there's the risk. So the role of the management and the supervisors on the floor to help keep people focused is extremely, extremely important. They're worried about what's going on with their families at home. Is their coworker who's just sneezed? All those types of things. It's a distraction, and you can't let your guard down. It's like texting while you're driving, right? And you might get away with it 10 times, and the 11th time it's catastrophic, and because these processes are so delicate. So I give take my hat off to all these people running these operations, because they were just phenomenal. I think the role that we played, and we talked about it, and Doug was part of it, and Sam was certainly in the forefront, was helping them interpret all the things and then advocate for the industry as a whole when some of the rules came out that had unintended consequences, right? That it wasn't really the intent, but it really would have been catastrophic in a manufacturing environment. So that was a big part of the role. But I think a couple other things. First off, I think the industry and other industries as well are going to be so much better coming out of this. We've learned where the weak points are. We learned where there was opportunities. We've learned to let go. The old telephone thing, you reach out and touch someone, right? The industry, pharmaceuticals in general is a conservative industry by nature. And so they wanted to be able to reach out and touch people. I think we learned how to operate differently and be much more efficient in the future, much more better for the employees. So there's no doubt that coming out of this, these companies are going to be so much better than they were before. They're going to be so much more efficient. The biggest issue I see, so I had a lot of confidence that the companies would solve their internal stuff. Yeah, it wasn't going to be easy, but they'd solve it. And actually supply chain forward is pretty simple. Supply chain backward is where the challenges were. This isn't an industry where you can just change a supplier because somebody runs out of stock. Because you've got to do validation, there's leachables and extractables, all contact, all that kind of stuff, right? So you have to make sure that you can be perfect internally, but if your supply chain isn't robust enough, and quite frankly, when you don't have issues, it kind of drifts a little bit because it's not the top of mind thing that you're worried about. But this really brought to light that all the way back to the raw material that goes into the gloves and things like that. And then you, as Christine said, you had demand from all other new sources for some of these critical materials that you were using. So I think that was probably the bigger challenge, was the supply chain backward, because you don't have as much control over it as you do the supply chain moving forward. And those things were just getting the stuff to the patient is relatively easy. Now, the good thing is we typically have higher levels of inventory. So you can survive periods of time. And some of it's just because of the cycle times and the cycle times of testing and release and all that stuff. So you have more inventory. And in some critical things, the government holds a critical stockpile, right? So they may, I don't know if they tapped into it this time, but they have in the past. But I think the supply chain backward was the biggest long-term challenge. Once it got past a few months, right? A few months, yeah, we probably had enough stuff in the chain, but once it got past where you're relying on ongoing production, you know, and you've got to rely that they're doing the same things in their plant in the middle of nowhere, right? That's supplying a critical component for you that you're doing in your plant, and they're keeping the same quality levels through this. So that's where I think the big tripping points could have been. But again, my hat's off to the people. I mean, I've been in those issues, and in my 10 years running the plant, I didn't have anything to go through like they've gone through. And it's like kind of like pilots, right? They run on autopilot all the time, but when they don't, you want to have a very experienced person driving that plane, right? That get you down. And that's what these people like Christine have done. So.
That's a great analogy, without a doubt. You know, workforce is so important in every industry that, or people in different industries that I talk to and that we talk to at the magazine. Regardless of pandemic or anything like that, workforce and finding qualified workers and businesses looking for that is always in forefront and center, you know, in terms of a challenge and those type of things. How do y'all help with that? How do you guys help answer businesses' needs for qualified workers?
Well, the thing about it is, and I've always seen it this way, the great thing about our partnership at the community college with industry is that a lot of it is more dynamic. It's not just here's a class, it will fit your role and what you need. It's more of let's tailor it, let's customize it, let's come up with something that you can't get just anywhere. It's more relative to your industry and what you're trying to do. And then we try to go along with the technology too. We don't just get stuck in the way things were 20 years ago. We really try to stay with the technology that the industries have the capability as well. So I think that's the benefit of the community college system doing this arm of biotech training.
Mm-hmm. What are some of the challenges that you face?
Well, you know, challenges are always about the time in which you're trying to operate, right? The challenges change, and I tell my folks all the time that the landscape changes, right? Absolutely. So you have to adapt and pivot. I think right now the biggest challenge is not so much the COVID situation, but what does the face of education look like moving forward? We had, when all of this happened, we were a very hands-on center. You know, a lot of our training, you know, revolved around our clean rooms and equipment that we had, and our industry trainers were years and years of experience in the industry, and so what they knew and they brought to the table was that same concept, which was great. And then we got shut down.
Right.
And at that point, you know, we were trying to do a more immersive environment for our students, for our industry partners, and that went away quickly. And all of our industries really had to focus on their manufacturing outputs. So, you know, a lot of our training just stopped. So what we had to do really now is, and after that, a few months later, we started working on more virtual learning opportunities. So we really, a lot of our industry trainers kind of retooled and became, you know, online learning specialists.
Right. Exactly.
And so we've been doing a lot of that. And our industries have really appreciated that piece, that we're able to pivot with some of our programming to offer them training. The other thing too is the BioNetwork has an arm of it that does digital learning. And before the pandemic, it was a piece, you know, I always felt like it was a piece of the puzzle, but now it's like a huge chunk of the puzzle, because they're having to do, you know, teach pH meters, how to use pH meters online. And they're having to really show how you do, you know, certain manufacturing functions online through video, through immersive learning, through technology, instead of immersive in-person learning. And so that's the challenge moving forward, is where will we land?
Yeah.
You know, how will that look for business and industry moving forward? Do they still want us to stay virtual? Do they want us to go back to in-person? Do they want us to have a hybrid model of that? And I think that's a challenge for any secondary education, you know, college or entity. You really have to listen to the industry, and we're doing that now.